I'm Lisa Boone. I'm your MS Ambassador. Today's workshop is called Food for the Brain, and it's being presented by the MS Center at Evergreen Health in partnership with the National MS Society. We do provide lots of programs for you. The telephone number, 1-800-FIGHT-MS, is very important. We have lots of people who are staffing the telephones who know what they're doing. And if they don't know the answer to a question you've got, they can find the answer. So please give them a call with any problems. And Ted Brown, it's yours.
I'm Ted Brown. This is Lisa Boone. Thank you very much. We really appreciate the MS Society for supporting us and helping us with planning and the registration process. And this has been a nice partnership for this particular program that we've done for 3 years now, and we hope we can keep it going if you find it useful. It's really got to be worthwhile to you. But the reason why we started doing these is because we had patients coming to our center saying they want to know more about nutrition. And we'd say, well, there isn't that much that's known about nutrition in MS. And so we said, well, let's do what we can. And we started getting guest speakers and some local speakers, and we hope to just keep it going. So this is our agenda for today. We'll try to get back on schedule, so I will go quickly through my presentation. And I just thought I would talk about some key elements to living well with MS. Dr. Laura Picchio is our guest speaker, and I'll tell you more about her in an introduction, and she'll be giving us an overview of the state of our science in MS and nutrition, and talk about her own exciting research that she's doing. And then we'll have Jan Rystrom, and she'll be focusing on the Terry Wahls diet that you might have heard of, and also talk beyond that as well. All right, so our sponsors for this, we had support from Accorda, Genzyme, Novartis, and Teva listed in alphabetical order here. We appreciate their supporting this program. So I work at the MS Center at Evergreen. We're in our 10th year now. That's our building, which is across the street. We do comprehensive MS care, we do research, and have a strong rehabilitation program, and also free parking there while it lasts. You never know what's going to happen with that building of Totem Lake Mall. I think everyone might come and park at our building. These are my colleagues here. We have Dr. Virginia Sintak, she's our medical director for neurology. Pat Morgan, she's our MS nurse, and Lorian Friedman is our medical social worker. And we have a lot of other people in our team, including neuropsychology and our rehab team and our front office people. All right, so MS research is really exciting. I only do MS, and yet it's very challenging for me to keep up on the research in this one particular disease state. So there's just so much going on, and every year I kind of show a slide about all the trials, and it just gets more and more. I think last year there were about 400 plus trials in the US, and now it's 750 trials going on. And partly that's because most trials take more than 1 year, and so they kind of linger for 3 or 4 years, and then other new studies come on. Just in our Seattle area, there are 27 active trials recruiting patients right now. So there is an opportunity for you to get involved in research if you care to participate. This research does ultimately come into clinical care. We learn things that can have an impact on people living with MS and how we treat MS. This is some of the research that we're doing right now. We have an ongoing study in looking at bone marrow density in MS. That study's close to enrollment, but we still have about a year to go, I think, on that, and we appreciate those of you who participated in that. We have a couple of MS drug studies. We have one that's looking at the gut microbiome with dimethylfumaric acid, that's the DMF, and then another study looking at quality of life metrics, monitoring people long-term while taking that medication. We have a study to reduce injection site redness related to one of the MS drugs called Plavix. It's an interferon. That is an injection site redness. And then we have a study to improve bladder control. And so we're combining pelvic floor exercises behavioral education, and a placebo-controlled trial of a drug that was recently approved for overactive bladder, and we're studying it in MS for the first time. And then we have a study of laughter therapy, which is beyond just multiple sclerosis. We're doing it for other neurological conditions, someone with a stroke, with Parkinson's disease, or even Alzheimer's disease. As long as it's in the central nervous system with a couple of exclusions, you could participate. There are 8 sessions of laughter therapy with a trained therapist who's taught here before, and it'll be right down here in the education center. And there's no control group, there's no placebo. Everybody gets the laughter therapy. So if you're interested, we're enrolling now, and it's very easy to qualify for this. You just have to be willing to smile and participate. All right, so what I would like to talk about is what are some of the things that are practical that we can all do, those of you who are living with MS, to kind of optimize your management of this. So I call it the MS Cookbook. And got this idea from Alan Bowling, who was one of our speakers 2 years ago. He came and spoke here, and this is a book that Dr. Bowling wrote. And I heard him give a talk just a couple months ago where he said, here are 7 things that he would throw out as things that are, this was a doctor talk, so it's things that we should be talking to our patients about. And I've revised it a little bit, and I'll give you my own list of 7 ingredients to achieve optimal health. And here's my list. Take your medications as they're prescribed. Stay connected with MS drug development, whether or not you are taking an MS drug. You want to know what's going on because there's so much going on. Vitamin D, having an adequate level of vitamin D, which usually means a supplement. Regular exercise, managing stress, don't smoke, get a good night's sleep, and a healthy diet. And hopefully your coming here will give you some ideas about healthy diet. All right, so we'll kind of just run through those 7 things very quickly. We've now come through a generation of MS drugs. The first one came on in 1993, and today we have 14 drugs, and we have more that are on the way. There will probably be at least 1 drug, maybe 2 drugs every year from here on out that get FDA approval. The latest one was just 2 months ago that it came along. So we have various ways of administering drugs. We have injectable medications that are done at home, either subcutaneous or intramuscular. We have 3 oral drugs that are approved right now. Then we have some infusion medications, and the most recent one is another injectable medication on the list there. All right, just to summarize where we're at with the MS drugs, they're all expensive. There's a lot of cost involved in drug development. That's just a fact that we unfortunately have to do. More expensive in the US than anywhere else in the world. They all act on the immune system right now. That's how these drugs work. They reduce the frequency of relapses, disability, and MRI activity, and they really can make a difference for someone's long-term status. The newer drugs are stronger, but they have greater risks as a rule. So we kind of have a bit of a hierarchy in terms of drugs that might be not as strong in their effect on the disease as other drugs, but are safer. And so we're balancing in every case. Secondary progressive MS does not seem to respond as well as relapsing remitting MS. So we try to treat patients earlier. The sooner you start, the better these drugs work, since early in the disease is when there tends to be the most inflammatory component, and that's driven by the immune system, which we can modulate. And then we still have no drugs approved for primary progressive MS, not directly as disease-modifying drugs. That will probably be changing in the next couple of years. There's a lot of work going on in neuroprotection and treating progressive disease. We have had some recent disappointments. Tysabri was tried in secondary progressive MS, Gilenya in primary progressive MS, and then very recently, just last month, reported anti-lingo was a drug that is in development for relapse recovery and optic neuritis, and that was an unsuccessful trial. But this work goes on. Ocrelizumab is one drug that is now fast-tracked by the FDA and may be approved for relapsing and progressive forms of MS. You've heard about Biotin, I think, and there have been some mixed results on that, but it's been looking effective in an acute optic neuritis setting, and most recently was reported in more of a chronic optic neuritis setting, and that was a negative study. So some mixed results on that one. Phenytoin is also known as Dilantin. It's an anti-seizure medication. There's some intriguing early studies looking at that in optic neuritis recovery, which were positive. Alpha-lipoic acid was recently studied at Oregon Health Science University. It had an effect on improving brain atrophy in that study. Statins, similarly, in a study done in the United Kingdom, had an effect on slowing the progression of brain atrophy or loss of brain volume. Ibutylast is being studied in the US, and this is a large phase 2 study that's nearing completion right now, and it's hoped that that'll have an effect on brain atrophy as well. And then there's a remyelinating antibody among several, and I just picked one because it's probably the most well-known of these that's in phase 2, but there are other remyelinating drugs that are in development. So whether you're on an MS drug or not, you want to stay tuned to what's going on because new things are coming, and we're doing a better job now matching a patient's needs to medication that can help them. The impact of MS drugs may be more than we think. Here's a study that looked at the long-term results of the initial beta-seron study that led to the first drug to FDA approval. They followed these patients up over 21 years. It was a placebo-controlled study. They found that the patients who initially got drug, as opposed to getting placebo in this blinded study, they had less mortality at these 21 years. There was a statistically significant difference there. So, do we think that these drugs directly affect mortality? We would say in most cases no, but here's evidence that when you follow a group of patients over this long period of time, we really did see a difference in mortality. All right, moving to number 2, vitamin D. We're living in the Northwest, a lot of vitamin D deficiency. We recommend it. So here's a map on the bottom here showing the production of vitamin D. And you can see that since it's mostly driven by the sun, it's going to be higher in the equatorial areas and lower in the temperate zones. And then up above, there's a map showing the MS prevalence. And you can see we could do this worldwide, but even within the United States, that you see higher prevalence in the more northern states. And vitamin D deficiency may be one factor there, because there's a lot of evidence supporting vitamin D deficiency as a risk factor for getting MS. Here's a study that looked at vitamin D status in patients with the earliest stage of multiple sclerosis, which we call clinically isolated syndrome. That's CIS. That means you've had the one attack, but you haven't had the second attack that would satisfy the criteria for MS. Because MS is a chronic disease. It's not a one-time hit on your nervous system. But they studied these patients for a year, and they found that in the graph to the left, that those with the lower vitamin D levels, and this is a different measuring system than what we use in the US, had a higher risk of converting to MS. And over here on the right, the people with the lowest vitamin D levels had the highest likelihood of having enhancing contrast, enhancing lesions on their brain MRI as well. Question about whether vitamin D2 or vitamin D3 is better. Traditional protocols suggest using vitamin D2, and we still use that in our clinical practice. But several studies have suggested that vitamin D3 may be more potent than vitamin D2. Most of what you see in the stores is vitamin D3. What we do in our center typically is when someone's quite low, we'll give them a booster dose of weekly vitamin D2 to get them up into a normal range, and then we'll have them switch to vitamin D3, which is what you mostly see in stores, and continue on that. And what's the right dose? It's hard to say, but 2,000 units will usually keep people in the normal range of vitamin D. And Dr. Picchio may be discussing vitamin D as well. Yes. All right, next, regular exercise. Really important. This one gets 2 stars because it's just right at the top of the list in terms of it's something that we all need with MS. You really need this. There's a lot of evidence, it grows all the time, that exercise has beneficial effects on MS. At the same time, there's really no evidence that exercise has bad effects on neurological disability, disease activity, or fatigue, which people always worry about, with my fatigue going to become worse. You just have to have a good program. There's more evidence beyond MS, really, that exercise helps preserve brain volume. This is a study from the Framingham study in the Northeast. They had 1,000 patients. They did a baseline brain volume test when the people were 40. They asked them questions about their fitness. They did an exercise tolerance test, that's the ETT, to see how fit they were. Then they followed them up 20 years later. They repeated the exercise tolerance test, repeated the MRI, and they found that poor cardiovascular fitness at baseline, and higher blood pressure, and higher heart rate response, which would indicate deconditioning, that your heart rate goes up more when you exercise. Those all predicted smaller total brain volume in 20 years. So exercise may help the health of the environment in the brain. How to keep the momentum going? Exercise when energy is greatest. For most people, that means try to exercise in the morning. For most people, choosing moderate or mild intensity exercise is better than very strenuous, intense exercise. We want people to have indoor and outdoor options so that come rain or shine, you have an exercise program. And generally, it's very good to have combinations of exercise. So you might do something 1 day or 2 days a week and do something else 3 days a week. Track your progress so that you get that feedback and it's motivating. And it also holds you accountable when you track your progress. But we do say reduce your exercise on fatigue days. Fatigue is a very common symptom with MS that tends to fluctuate from day to day. And we want people to adjust their exercise program according to their fatigue levels instead of saying fight the fatigue. If you're having a day where you really feel low in energy, it's better to say, okay, I'm going to take it easy today. I'll do my exercise program tomorrow. And be consistent. It's like taking an MS medication or taking a drug to control your blood pressure. If you do it for a short time, just a concentrated bout of exercise, those effects will last a couple of months. But you've got to live with this disease, and you really want to have a sustainable program. It's doing exercise consistently for years that will really change your long-term outcome. Next on the list is just healthy ways of managing stress. We all live with stress. And we have to have ways to channel that in a constructive way, as opposed to letting it eat away at us, make us more symptomatic, sometimes physically symptomatic from just the stress that we're experiencing. So whatever way that is, or it might be a combination of ways to manage stress, make sure that you have a stress management program. Evergreen was involved in a study that looked at a stress management program to treat multiple sclerosis. This was a randomized controlled trial of a stress management program taught by a psychologist in a one-on-one setting. And the primary outcome was those gadolinium-enhancing lesions on MRI. And we found that the stress management program led that group to have fewer new brain lesions on MRI. So this was direct evidence that stress management can make a difference in disease activity. And shifting gears, fortunately at this point it looks like coffee is okay with MS, and you can read more about this online, but drinking coffee may possibly have a protective effect in terms of lowering risk for getting MS. Well, smoking is a different deal. Okay, so we do want to have all of our patients and everyone not smoke. There's a couple of numbers I think that are in your handout about how devastating effect smoking has on health. Within MS, we have studies that have shown higher risk of transition to secondary progressive MS, 3.5 times greater risk, and that's a couple of studies, not just one. Higher level of disability has been observed among smokers versus non-smokers. Higher disease activity on MRI measures in smokers. Higher rate of transitioning from that first attack to clinically definite MS if you are smoking. And then higher risk of early mortality in MS with smoking. So quit smoking if you are smoking. Get a good night's sleep. Sleep problems are very common. and they can be primary problems like insomnia, sleep apnea, restless leg. They can be brought on by symptoms of MS, the pain, overactive bladder spasticity, medications that we use to treat MS, depression, among other things. Here's one study that looked at sleep problems and fatigue. They did polysomnography, which is a sleep study, and looked at fatigue ratings, and basically they found that this was a very poorly sleeping group. There was a lot of fatigue as well. 96% of fatigue patients had a sleep disorder. I mean, almost everybody with fatigue had some problem with sleep. There's a lot of things under that umbrella, but some problem with sleep. 60% of the non-fatigue patients had a sleep disorder. So in this cohort, more than 50% of the patients had some sleep problem. The risk of having a sleep disorder increased the odds of having fatigue by 18-fold. I don't have time to go into detail about what is good sleep hygiene, but there are books on this. There's a lot of stuff online, and you can talk to your healthcare provider about ways to make sure that you don't have distractions in your bedroom at night to help you get better night's sleep, and some other behavioral things that you can do. Healthy diet, lastly. So first, at this time, there really is no established MS diet. We're still learning, we're studying things, and perhaps someday we will say these are specific dietary recommendations, but right now it's still an exploration. It's a journey in progress. We would say keep portions moderate. We don't want people overeating. We would say that there's some suggestion that trans-saturated fats are bad for people with MS, just like they're in general bad for people. And mostly plant-based diet is good. Eat the rainbow just means have a lot of different colors in your diet containing micronutrients and antioxidants. But we still have a lot to learn. Hopefully you'll learn something today. So those are my 7 steps that I wanted to talk about. I'll just leave it there for a second. If you put these all together, hopefully you can build a nice place to live. That's my son. Thank you.